Hey, I'm Dr. Rick Boulay. I'm a gynecologic oncologist with the National Ovarian Cancer Coalition. I'd like to take a minute today to look at what the journey is like as we go through evaluation and treatment for suspected ovarian cancer. So this is someone who shows up in our office that has a mass or a cyst or something on their ovary that just doesn't look quite right, and how we best manage that. Well, the first thing, as we talked about before, just because it's there doesn't mean it's a cancer. So the first thing we do is to make an assessment of what the likelihood that this will be a malignancy is. So even a medium-sized, grapefruit-sized, simple cyst, so it's filled with fluid alone, the risk of those being cancer is less than 1%. And oftentimes we don't have to do anything. It just goes away by itself. The risks of surgery we have to balance, and they run in the 3% range of damage to any structures or bleeding requiring transfusion or infections and things like that. And then the risk of ovarian cancer has to be at least that level to warrant the risk of the surgery, right? So if we then find a mass that's either not going away or hurting or big or suspicious with blood work, there's a number of things, and we decide to take that out. There are two tenets of that surgery. The first one is we want to take this mass out intact. We want to make sure we don't pop it, because if there's a cancer on the inside, we don't want to give it a chance to spread anywhere. And the second thing is, if we do find an ovarian cancer, we want to remove all the visible disease. We want to take out everything that we can see to give the patient an opportunity to do the best. Your doc, who's doing the surgery, preferably a GYN oncologist, will go through this with you and say, if this, then that, if this, then that. And it differs on people as far as their wellness is, as far as their health, heart disease, that sort of stuff, if they want to get pregnant in the future. But usually it starts with removal of the affected ovary. And that can be done laparoscopically with small incision. And then we have our pathologic assessment. We send this right to the lab, and usually within a half hour, we get a word back whether it's cancer or not. If it is, then we have to go further. If it's not, then surgery's done right there. So we take random biopsies of that, or if we see something, we take it. Or in other cases, we actually see that the cancer is spread, and then we want to get all of that out so that there's no disease left. All of these questions can be best managed in your case by your GYN oncologist. Here at the National Ovarian Cancer Coalition, we are supporting your journey through ovarian cancer. We are here. We can help.